So in that, so because if anyone will ask the doubt, I will also explain the doubts also. One more is doubt, that one more doubt it is not only the doubt will be asked on YouTube, outside also, outside the YouTube platform this doubt can be asked. The doubt is why bed rest, why bed rest is given for those patients who are suffering for mostly respiratory disease. So the patients who are suffering for respiratory disease, why bed rest is recommended for those patients. I will give an example. I will explain why we are giving this. Actually, what happens? See, in case of respiratory disease, we are talking about pneumonia. In case of respiratory disease, in case of respiratory disease, respiratory disease, we are talking about pneumonia. We are talking about pneumonia. Not only pneumonia, we are talking about COPD. COPD means chronic obstructive pulmonary disease. Okay, COPD, chronic obstructive pulmonary disease. Or we are telling about asthma. We are telling about tuberculosis. So there are many diseases that are linked to the respiratory system, mostly lungs. So what I will say here, see here, what actually I want to say, in case of these disease, why bed rest is mostly given for the patient. What will happen? See, in case of pneumonia, I will give an example. In case of pneumonia, I will take here a pneumonia disease. I will take the disease here. For example, I will take pneumonia. What happens in a pneumonia? What happens in case of pneumonia? What will happen in case of pneumonia? Here I will show. In case of pneumonia, what will happen? The secretions, secretions in the lungs will be increased. The secretions in lungs will be increased. What are those secretions? That secretion means mucus secretion. We can say the mucus secretion in the lungs will be increased in case of pneumonia. Okay, so what will happen when secretions are being increased? When secretions are increased in the lungs, and they will what? They will interfere. They will block oxygen, block O2. They will block O2 exchange, because the oxygen exchange in the lungs occurs by the by the diffusion, by means of diffusion, that is passive transport. I explained in the lecture. You can see that lecture is cell biology. I told what is passive and active transport. So in passive transport there is a one transport that is called diffusion. There is a type that is called as diffusion. In case of diffusion, remember one thing. In case of diffusion, remember, in case of when there occurs exchange of gases between the alveoli of lungs and the blood, that exchange occurs by means of diffusion. So there will be they will block. So when there is excessive production of mucus in any disease, in any respiratory disease, in any pulmonary disease, when there is excessive production of mucus, what will happen? The gaseous exchange will be interfered, because the diffusion of gases will be interfered. Because definitely, why? Because there is production of mucus is high there is high, as well as there is not, because diffusion occurs then only. I told already, diffusion occurs then only when there is an it is a passive process. So when there is high concentration, low concentration, and it depends upon the membrane also, how the membrane is there. When production of mucus is there, there will be less transfer of oxygen, because mucus is acting as a barrier. So what will happen? And also in these diseases, in many respiratory disease, the lungs does not have so much of capability. The lungs have alveoli. The alveoli have not so much of capability to to take oxygen, to expand, to take oxygen, or to give oxygen to the blood. So that is actually what happens in the respiratory disease. When there will be block of oxygen in the respiratory, in the lungs, what will happen? This oxygen is not going to what? This oxygen mostly goes to the tissues. This oxygen will reach to the tissues. When this oxygen reaches to the tissues, our body organs are doing any activity. But here, remember one thing. I think you got the answer. Whenever there is presence of oxygen, then only our organs will do any function. If there is not oxygen, if there is no deliverance of oxygen towards our organs, towards our body organs, definitely the body organs will die, the cells will die, and the body organ will die. Body organ will not do its function. What I am saying about the tissue. When there is no deliverance of oxygen towards the tissues, when there is no when what will happen? So it will reach the tissues. When there is less oxygen exchange, no exchange of O2. When there is no exchange of O2, there will be less oxygen in the blood. When there is less oxygen in the blood, less oxygen will reach to the tissues. Less oxygen will reach to the tissues. What will happen? What will happen? Remember. If the patient is doing active process, if the patient is doing any active movements, if the patient is doing any active movements, if the patient is doing any hard work, if the patient is doing any hard work, if the patient is doing any exercise, if the patient is doing any exercise, if the patient is doing any work, what will happen? If the patient is doing any work, what will happen? The body organs need more oxygen for work, definitely, because body, whenever there is when we are doing more work, definitely there will be more respiration. When more cellular respiration will be there, for internal respiration, for aerobic respiration, oxygen is important. So more demand of oxygen will be at the cells. When oxygen is coming very less but demand of oxygen is very high, in case of active process, when the patient is working, when the person is working, when the demand is very high but oxygen is coming very less, what will happen? The cells will die. The cells will. That is why bed rest is given to those patients who are suffering from mostly respiratory problems, mostly pneumonia, mostly COPD. In case of severe case, I am saying. So we are giving bed rest because there will be less deliverance of oxygen towards the tissues. When less deliverance of oxygen, there will be less. There will be less O2 exchange at the lungs. When there is less O2 exchange, there will be less oxygen in the blood. When there is less oxygen in the blood, less oxygen will reach to the tissues. When less oxygen will reach to the tissues, what will happen? The tissues, because if the person is in bed rest, the tissues will try to make an equilibrium. Try to the tissues will try to make this demand in perfect way. Suppose if they need oxygen, if they are using suppose if the cell is using the oxygen, suppose we need for our cells, we need more than 95% oxygen saturation should be in the blood. More than 95% oxygen saturation should be blood in the blood, and that is a normal oxygen saturation in blood is 95, more than 95%. So what will happen? When oxygen is not reaching, when oxygen will reach to the cells in slowly, no worry, because patient is in bed rest, so the organs of that patient are not working so much, so easily the cells will not die. But if the patient is not doing bed rest, if the patient is doing any work, definitely more oxygen requirement is there, but the lungs are not giving that much of oxygen, but there is no that much of exchange at the lungs. When no oxygen is going towards the tissues, definitely the cells need more oxygen, but oxygen is not present, definitely the tissues will die. I will give an example. It is like this condition. Suppose today is a cloudy environment. When there is cloudy environment, there will be less transpiration of water. If we keep water bottle, if we keep, suppose a plant is there, plant will lose the water very less, because it is cloudy atmosphere. It is cloudy atmosphere, so the sunlight is not there. So easily the plant needs very less water to make to make its day-to-day life. So no need for a lot of water. Suppose if the same condition, if the sunlight will be increased at the if the sunlight is coming, if now it is not cloudy, it is sunlight is there. When there is sunlight, when there is high temperature, the plant also need more water. So when there is now demand increases, when plant needs more water for transpiration, definitely there should be more water. If the water is not more in the surface, the leaves will curl, the leaves will die, the plant leaves will curl, and they will lose their function. Oh, that is the same function will happen in case of human body. I hope you understood that concept. Thank you.